Hello, and welcome to an informational webinar on Individual Education Program, or an IEP. My name is Stacy Zimmerman. I am the Prader-Willi Association of Colorado, PWS ACO IEP consultant. I have been with PWS ACO for over 4 years. I taught special education for over 15 years. As a special education teacher, I worked with students with PWS, autism spectrum, and other medical, learning, and physical disabilities. Currently, I collaborate with a multidisciplinary team at the Children's Hospital of Denver at the PWS Multidisciplinary Clinic. We have over 160 patients and the biggest PWS multidisciplinary clinic in the country. With support and collaboration with the providers from the PWS clinic, I can effectively support families. I support families and schools with their child's individual education program, or IEP. What is an IEP? IEP stands for Individualized Education Program. The IEP is a written document that describes the educational plan for a student with a disability. The IEP will support, plan out, and meet the needs for a student with special needs. It is important to have positive relationships with schools. As a special education IEP consultant for the Prader-Willi Syndrome Association of Colorado, PWS ACO, I have worked with many families and schools to encourage meaningful parent and school collaboration and positive communication. It is important that parents participate in their child's decision-making at school and transitional programming. As parents and schools learn the value and methods of collaboration, they will create together an educational environment that supports the student's success. Parents and schools need to feel comfortable to communicate via written notes, email, text, or phone call at any given day. This training provides guidelines for early intervention programs, K through 12, and 18 to 21 programs. To build rapport with the schools, parents can educate the school team on what Prader-Willi syndrome is and personal information about their child's well-being. PWS USA can be a helpful tool for families to get any resources or materials educating students with PWS in the school setting. PWS USA can provide DVDs, pamphlets, and other materials to help support and educate the school team to better understand the needs of educating students with Prader-Willi syndrome. Parents can contact PWS USA for materials they may need. Some key points to promote a collaborative and effective IEP are remembering that you have a common purpose, letting everyone have a voice, assuming good intentions from everyone, valuing the team and members, trusting the process, practicing effective listening skills. Remember, positive communication, building a good rapport with all team members is the key to a successful education. In the beginning of an IEP, it is important to have meaningful and detailed information describing the student's medical needs. Documenting information in the healthcare plan is a great place in the IEP for the school team. Addressing health issues. For example, one might put in a healthcare plan the following. Prader-Willi syndrome, PWS, is a complex genetic disorder that occurs in approximately 1 out of every 15,000 births. PWS is recognized as the most common genetic cause of life-threatening obesity. PWS affects appetite, growth, metabolism, cognitive function, and behavior. It affects both males and females of all races and ethnicities. Although the cause is complex, it results from an abnormality on the 15th chromosome. PWS is characterized by hypotonia, low muscle tone, and poor feeding in infancy, and hyperphagia, an uncontrollable drive to eat, combined with weight gain on fewer calories. There are learning difficulties and complex medical needs associated with PWS. Another example of what one might add into a healthcare plan is the following. First, it is important that the student, we will use the name Sally, gets the right number of calories each day. Because of her condition, Sally's calorie needs are much lower than other children her age. It is important for Sally's health and well-being that she only eats food that is calculated to meet her strict calorie requirements. Second, this condition means that Sally has a defect in her ability to feel full. This makes food a stressor for her. Sally must have a consistent routine with no unplanned deviations from her routine. This is crucial for Sally's well-being. She must have no opportunity for obtaining food meant for others. This requires constant supervision to ensure that she is not stressed by the possibility of getting foods from others. Finally, it is important that Sally does not experience an emotional letdown from false anticipation or unfulfilled expectation about food. When access to food is appropriately managed and in Sally's mind there is no doubt about what she will be eating, no hope of getting other foods, and no disappointment about food, she will be less stressed and will have improved behaviors. In addition, it is important to document the student's calories per day, what the student will be eating. For example, parents may provide school meals. The school lunches might be plated prior to the student walking into the lunchroom with appropriate calorie counts. Conversations with the cafeteria staff is important. It is important to add any other medical reports and or sleep issues that the student may exhibit. IEP meetings. Be prepared. Parents should take some time to fill out a parent input questionnaire. This may include your child's strength, behavior performance, social interaction, describing your concerns or needs, your child's goals are for the next year. If the school does not provide this questionnaire, parents should create their own document covering these issues and share this information with the IEP team. Parents' input is important as the equal participant contributing to the IEP. Parents should also, if allowed by the school, and this varies state to state, request an IEP draft a week before the IEP meeting, so they have time to go over and process this information, as well as time to take notes on the IEP draft. This will provide a well-organized, thoughtful, and meaningful IEP. It is important that the IEP is designed to be family-friendly. Some key areas for this to happen are: be mindful of the time at the beginning of the meeting, and if it needs to be extended, have another date planned. Making sure parents are contributing and a part of these conversations. How can parents become involved in a meaningful way? Making sure parents do not feel intimidated at the IEP meeting. Language and cultural differences. An interpreter at the IEP meeting is necessary. Parents feeling welcome at the school and feel comfortable and supported from staff and administration. Parents should always ask questions throughout the IEP. There's a lot of information, and it is important that parents feel comfortable to ask questions for a better understanding. Parents will receive the Safeguards packet. It is important to read this. Parents can ask for this packet prior to the IEP meeting to review beforehand so they understand their rights. The IEP meeting. Who attends the IEP meeting? Typically, the special educator, case manager will facilitate the meeting and begin with introductions. Parents or guardians, the student, if appropriate, special education teacher, general education teacher, Sometimes the principal and/or vice principal, the dean, and other providers such as speech, OT, PT, mental health, nurse, social worker, school psychologist, adapted PE may all be a part of the IEP meeting. In addition, transportation and cafeteria staff might be important to be at the meeting as well. As the meeting begins, everyone will go around the table and introduce themselves and their professional role. The case manager and service providers will provide the team with their report, the present level of academic achievement and functional performance. This includes strengths, needs, assessments, and the findings from the assessments. From there, they will discuss the student's current goals and future measurable goals to move forward in their instruction. Communication about appropriate goals, as well as parents having a good understanding of what their child is doing, is important for consistency at home and school. This is a great time for parents to ask questions about their child's strengths and needs. Parents should provide their input for academic goals, strengths, needs, and other service providing support. Accommodations and modifications are an important conversation at the IEP meeting. Students with PWS have unique needs that must be understood at school. The school team must accommodate these needs and address the needs in the accommodation/modification section of the IEP. As an example, here are some things to add into an accommodations and modification section. Students with Prader-Willi syndrome will need a food-restrictive environment. It is important the team understands the classrooms must not have any food. If there are birthday parties, holiday parties, or any food-related activities, the parents and staff must communicate with the parents prior to the activity and decide on what they will do as a team. There are many options and every child is different. However, whatever the parent would like to happen must be written into the accommodations area of the IEP. More information for accommodations, such as students with PWS may need to take a nap or a rest time during the day, especially in the afternoon. Conversations in the meeting around this will also need to be written into the accommodations section. Students with PWS may need brain breaks and other sensory breaks written into their visual schedules. Students with PWS may need a modified school day. Students with Prader-Willi syndrome may need direct supervision. This is an area of need because of the food restrictions and the behaviors. IEP teams may say they do not have funding to allocate for a paraprofessional. However, this is a safety need. Students that need a modified or accommodated academic instruction, preference in seating, small group, peer tutoring, etc., will need to be detailed into the accommodation section. Students with PWS will benefit from a visual schedule and consistency for their daily routine. This should be written into the accommodation section. It is important that if there are changes with the student's day, parents are to be communicated by the school and notified of the changes. The changes must be written into the visual schedule before the student gets to school. If students are getting their meals at school, the team can work together to plan an appropriate routine for the students' meals. As an example, the cafeteria staff can pre-plate the student's foods on the tray and have it ready for the student when he or she is in line retrieving his or her food. If this provides high anxiety, the student can have a staff retrieve his or her pre-plated food. Parents can have their medical providers support the appropriate calories for the school with a letter from their doctor written to the school. If parents prefer their child not to eat in the cafeteria, communication and documentation around this should be written into the accommodations section. Fire drills, other bells, any other noise from the school that can cause anxiety for the student. The parents can request their child go outside a few minutes prior to these bells and other changes in their daily routine. Parents should feel comfortable with any other details they want to write into the accommodations and modifications section in the IEP. The rule of thumb: document anything that is pertinent for the student to be successful at school. The more details, the better. Things happen. A staff that typically works with a student may not be there the next day if they are sick or a family emergency. The rule of thumb is to detail and document as much information in that section if they need to work with a different support staff. Functional behavior analysis, behavior intervention plan. Students with PWS may need a behavior intervention plan, or BIP, which is designed to help a student change his or her behavior. Once the function of a student's behavior has been determined, the function behavior analysis, the IEP team will develop this behavior intervention plan. This plan will support the student in order to change the behavior through appropriate interventions, support strategies, replacement behaviors, rewards, etc., which will also help decrease the problem behavior and facilitate general improvements in the quality of the student. The behavior plan can be tweaked throughout the year. Behaviors may increase and/or change, and the team must work together and meet with the parents to look at new strategies and tools to support the student and be more successful. It is important to note that the team should look at triggers as the student begins to escalate and intervene appropriately. Sensory strategies, breaks, and other preferred activities will be helpful for supporting the student's behaviors. Least restricted environment, or LRE. LRE means that to maximum extent appropriate, school districts must educate students with disabilities in the regular/general education classroom with appropriate paraprofessional and/or special educators to support the student. The school team will go over the hours they will provide for the student at the IEP. It is important to understand the amount of special education support hours, general education hours, and hours the service providers, speech, OT, mental health, PT, adaptive PE, etc., may provide. This is all documented on the LRE section of the IEP, which looks like a grid. The school team will provide information to the parents if the student qualifies for extended school year or ESY. This is determined if the student regressed after a holiday break. Ending the IEP meeting. If the meeting is coming to an end and the parents are not comfortable with finalizing the IEP, the parents can request another meeting to continue, and it will give the parents time to take home the IEP draft and read through the information and take some notes. If parents have more information they would like to share and/or add into the IEP document, they can call the special education teacher throughout the year and request for a special request IEP meeting. It is important that parents and guardians understand they can request for a special request IEP anytime throughout the year to discuss those concerns. Academic goals may change, and they may want to have a meeting to communicate about that instruction. Parents are involved in their child's school at any level and have opportunities to learn more about how their child can be successful. If there is a difference of opinion or conflict, families and schools are more willing to discuss issues effectively if the IEP team has established early positive communication. In addition, teacher morale improves when families are involved and can appreciate each other's challenges. School staff will no longer see themselves as the expert or the provider of services, but more as a listener and bridge builder. They will create not a prescribed service based on diagnosis, but based on what the family says they need and want for their child to become more successful. Next steps. Free resources for each training module are available for download from the PWSA USA website, www.pwsausa.org. If you need assistance with a school issue, please contact PWSA USA at 800-926-4797 and ask to speak to a family support counselor. If you have questions or comments about this module or the WSEAT in general, please contact Evan Farrar at EFARR@pwsausa.org. This concludes this training webinar. Thank you for attending.